Swelling in comes always from one of three places in the leg. It either comes from the foot, the thigh bone, or the shin bone. From the foot, we always just look at the lateral border of the foot. Some people get something called metatarsus adductus. It is a curving of the foot itself. But metatarsus adductus, or just a turning in of the toes themselves from the ankle down, that will get better on its own. Occasionally we'll recommend straight shoes or reverse shoes. It's the typical, should you put your child's shoes on the opposite feet type thing. And it's some variant of that to help that move along. Then you can have it coming from the shin bone itself. This is called tibial torsion, or a twist in the shin bone. We examine this by placing the child face down on the table and looking at the relationship the foot makes to the thigh. In an infant, it's normal for it to be 5 degrees in from the thigh. In an adolescent, it should be 10 degrees out from the thigh. So if you look at the thigh and the foot, and the foot is in from the thigh, then they have what's called tibial torsion, or a twist in the shin bone itself. This is one that used to be braced and no longer needs to be. It should get better on its own. It's often associated with bow legs. It usually will get better 1 to 2 years after the bow legs gets better, and will reach maximal improvement by 8 to 10 years of life. If it hasn't improved at that point, and once again I reiterate, there's nothing you can do to speed that process up or make it happen any faster. The only way to fix that is to cut the bones, turn the bones, and fix them with plates and screws. We almost never need to do that. The only reason to do that would be if it was a functional problem and or the child is really displeased aesthetically with the way it looks. And then you have to discuss what the risks and benefits are of that surgical procedure. The third place it can come from is the thigh bones. And once again, this is evaluated with the child lying face down. And we sort of look at what the knees do when we try and bring the foot from side to side like a windshield wiper. Most children are born with external rotation deformities just from the position they are in the womb. And then by the age of 3, 4, 5, we start to notice that the legs will go flap way out to the side. These are our kids who sit in a W. And they do that because it's easier for them to move that way than to sit Indian style. And this too will get better on its own. No degree of bracing or physical therapy will change it. And it maximally improves by 10 to 12 years of age. If you look at a kindergarten class, you see a lot of kids sitting around playing in a W. If you look at a 5th grade class, no one's doing it anymore. It's not because it's socially unacceptable, it's because their bodies have undergone change. And the most important thing is, if you're concerned, don't hesitate to ask an orthopedic surgeon. We always check an x-ray of the pelvis. The one thing you don't want to miss is abnormalities around the hips that are causing this. And that's what we'll do. And 95% of the time, I'll take an x-ray and tell you, your child's going to be fine. And this is the ages that you can expect it to get better. The take-home message is 95% of these children will get better on their own.